We acknowledge we're on the traditional lands of Treaty 4 territory, a treaty signed with 35 First Nations across southern Saskatchewan and parts of Alberta and Manitoba, and the original lands of the Cree, Saulteaux, Dakota, Lakota, Nakota, and the homeland of the Métis Nation. To ensure social distancing measures are being met during this time, some members of City Council and City Administration are attending the meeting today through video conferencing, as are delegates appearing via teleconferencing. I'd like to remind those members who are attending, ensure your video and microphone are off. If you wish to speak, use the raise hand function. And when speaking, remember to unmute your microphone and enable your video camera. All votes will be conducted electronically, except the first one where we approve the agenda. Can I have someone move a motion to approve the agenda? Thank you, Councillor Hawkins. Seconded by Stadnichuk, if you need one. Councillor Stadnichuk. And I'll call the question. Any opposed? Seeing none, carried. We'll start with delegations on CM 21-20. I'd like to call upon Delegation Serena Ward. Please introduce yourself for the record, organization you're representing, if any, and where you're calling from. You'll have 5 minutes to address City Council, after which you'll have the opportunity to respond to any question that members of Council may have for you. Good morning.
Good morning. Can you hear me?
One moment, please. We're just going to adjust the volume. Okay. Our volume is turned up. Can you check your volume, please, Ms. Ward?
I can. Can you hear me better now?
You're very, very faint. Oh, say it again.
How is this?
That's
is this better
perfect.
Now?
That's fantastic. Thank you, Ms. Ward. Please proceed.
Good morning, Mayor Masters, members of City Council, and other guests. My name is Serena Ward. I'm a resident of Southeast Regina. I'm calling from my home in Regina, and I'm representing myself and other interested community members in my area. May I start?
Please.
Okay. So again, as I mentioned, my name is Serena Ward. I am a resident of Southeast Regina. I'm an active community member, a mother of 2 young athletic children, ages 10 and 12, and I'm a professional engineer. I'm here today to advocate for extending the proof of the COVID-19 vaccination policy to all city-owned facilities. I've read through the document that you have in front of you today, and I wholeheartedly agree with the recommendation. The policy as it currently exists is inconsistently applied to all City of Regina facilities. That haphazard approach has created confusion for residents who are accessing the facilities, and it provides an unfair level of protection to some places and not others. This revision to the proof of COVID-19 vaccination or negative tests will help to fill some of the gaps. One of the big gaps that this will fill is related to indoor rinks. I'm very happy to see that the recommendation includes indoor arenas, as exempting them made no sense considering what we have learned over the course of the pandemic when it comes to how the virus is spread and when and where we've seen outbreaks. I think by now it's widely understood that COVID-19 is transmitted via the air and spreads most easily in indoor spaces, especially those with poor air circulation. Our city-owned rinks are mostly over 40 years old with aged ventilation systems. And arenas have also been shown to have an elevated risk of virus spread due to that cold air at the ice surface. As a reminder, by January of 2021 in Saskatchewan alone, there were over 20 separate outbreaks tied to arenas. After accepting today's recommendation, I would encourage the City of Regina to consider making it apply to a few more facilities, including the Evraz campus. The City of Regina is the owner and sole shareholder of the Regina Exhibition Association Limited, and our largest set of rinks is located on the Evraz campus at Cooperator Center. Unlike last season, there are no controls in place this year to limit the number of people in the facility. The only measure being employed is masks. Hockey and ringette teams have now all been formed, they're practicing, and very soon games and tournaments will start at this facility. I can speak from my personal experience to tell you we've already seen a drastic difference in the number of people in the center at any one time, and it has the same issues and risks as other indoor arenas and large recreational centers. And as such, I would encourage you again to consider including it in your proof of vaccination policy moving forward. As a professional engineer, I've spent a lot of time over the past 18 plus months thinking about ventilation systems and evaluating them for occupant safety and environmental health. Understanding and using proper ventilation as a means of mitigating risk from airborne contaminants is an important aspect in reducing transmission. However, making major modifications to existing ventilation systems takes a lot of time and money. Therefore, the next best steps in mitigating risk of transmission is to employ the other tools in the toolkit. And just to be clear, the tools I'm speaking of are vaccination, masks, physical distancing, limitations on the number of people who can be in indoor spaces at any one time. As a parent, I've spent a lot of time over the past 18 months worrying about the decisions my husband and I have made regarding our children's participation in sport. But being involved with sport has been absolutely crucial to maintaining both the physical and mental health of our kids. We want to continue. We want to continue in the safest way possible. Now, in our family, we've done all we can to be personally responsible in helping end the pandemic. We've been fully vaccinated. We wear our masks. We sanitize. We spend as little time in other indoor spaces as possible outside of our athletic activities. And we're not the only ones. Almost 80% of the population has done the same thing. Showing proof of vaccination is not time-consuming, it's not hard to do, and the City of Regina has already demonstrated it can be done as it has been done at other facilities. Just to recap, in 18 months into the pandemic, and I feel we have the tools now to help us manage the spread. We have vaccination available for anyone over the age of 12. We understand masking, physical distancing, and keeping numbers low in indoor facilities helps reduce transmission. And we know we have to better understand and make improvements to ventilation systems where we can. We also still have that remaining demographic at risk, the children under 12. We need to do all we can to protect this remaining at-risk group. They can't obtain protection via vaccines. We need to use all our next best tools, including proof of vaccination. Thank you for your time, and thank you for supporting this recommendation today.
Well done. Thank you very much for your presentation, Ms. Ward. I'm going to ask if any members of council have any questions of the delegate. I can't see.
I do, Mayor Masters. It's Councillor Bresciani.
Thank you, Councillor Bresciani. Please go ahead.
Thank you. Through you, Madam Mayor. Ms. Ward, thank you for speaking today. I just want to, you can elaborate on the arena piece that you spoke about. In regards to, you indicated that the amount of people coming through, is it increased or decreased, or is it, the amount that kind of go in for a practice, come out, and it's just an overwhelming, there's not a break? Or just elaborate kind of on the experience with the arenas through the chair.
Sure. Thank you for the question. Last season, if you guys will recall, we had protocols in place that limited the number of participants in any one group at one time. It also limited the number of spectators. Some were very strict in 0 spectators, and some were, 1 to 2 spectators per player. There were also kind of check-in and check-out procedures at that time. That's not in place this year. And as such, everyone's excited to be back at the rink and back watching practices. And this includes grandparents showing up. People are bringing multiple family members to practice at the same time. There's a drastic difference in the number of people that we see in the arenas this year versus last. I can say personally, I have a son who plays hockey, and last year I barely saw him at all because my husband was taking him to the rinks. This year I've already been able to see one of his practices, and I noticed there's just a lot more people around the rinks because of the fewer measures in place, which again is why I would feel more comfortable at least having proof of vaccination policy in place to know that the people in those spaces are vaccinated.
Great. Thank you very much, and that's all I have. Thank you.
Thank you.
Thank you, Councillor Bresciani. I see no other members of council have any questions for you, so I'll thank you again very much for your presentation this morning, Serena Ward, and ask that you please leave the meeting.
Thank you. Good day.
I'd like to call upon Delegation Kieran Conway. Please introduce yourself for the record, the organization you're representing, if any, and where you're calling from. You'll have 5 minutes to address City Council, after which time you'll have the opportunity to respond to any questions Council may have for you. Good morning.
Good morning. Can you hear me?
We can, sir. Please proceed.
Great. My name is Kieran Conway. I'm a family physician. I've worked in rural, northern, and urban areas across Saskatchewan. I currently work on the COVID-19 medical ward at Regina General Hospital and have done so since January 2021. I have no leadership role with the SHA and don't speak for them. I speak only as a citizen and physician, having witnessed immense hardship suffered by patients, families, and colleagues, particularly in the last 6 weeks. The healthcare system is experiencing collapse. Politicians and administrators may use euphemisms like slowdowns or challenges, but make no mistake, we are failing to care for many people completely and caring inadequately for many others. In the acute care system, we're currently caring in large part for people with one disease, COVID-19, and even so, we're transporting several patients every day to other jurisdictions. We now have the highest per capita death rate and the highest per capita ICU census of any province at any point in the entire COVID-19 pandemic. Outside of the acute care system, things aren't much better. Many medical investigations, procedures, and treatments are on hold with untold consequences. This is collapse. There is no other word for it. This collapse comes as a result of months of unchecked spread of the virus. The provincial government pushed reopening despite lukewarm vaccine uptake. Policies to improve vaccine uptake were slow to come and somewhat inadequate. Loopholes were built in to appease those with who value a particular notion of personal freedom above our collective health, and return to school plans were left to local divisions with no financial support to implement meaningful virus mitigation strategies. I read in the report a note, the idea about that cases are trending down, but I should note that testing has also fallen off. Our test positivity remains above 10%, which suggests many cases are not being identified. Almost half of patients admitted for COVID-19 are testing positive when they first present for care. Most of us on the front lines feel it is foolishly optimistic to see the fourth wave as having peaked. Frustratingly, our provincial government has persistently ignored the advice of medical professionals. On several occasions, hundreds of clinicians pleaded for more restrictions. In late August, the province's entire cadre of deputy medical health officers called for measures meant to steer us away from where we are today. Nurses and physicians' professional organizations have been united and vocal throughout the pandemic, and the chief medical officer, as many of you saw, was brought to tears last Wednesday when again we saw his advice not backed by policy or directive. The reliance on personal responsibility was misguided. The evidence bears this out. It has been a failure and people have died because of it. I have cared for those people. Almost every day I've had to tell families that their loved one won't get better from this. A very small number of them were not vaccinated due to deeply held and misguided beliefs. Others were misled. Some were hesitant for a variety of reasons and didn't get their hesitancy addressed adequately. But most just didn't see it as a priority. They hadn't met anyone who got sick from COVID, or it wasn't something they something they just could fit into their busy lives. The vast majority wishes they could go back and have a second chance. The vast majority asks me, when can I get the vaccine? I don't want to minimize the limitations that a proof of vaccination requirement puts on individuals' freedoms or their ability to access services. I recognize these, but I do think they are far less damaging than the alternative. It is time to front load and minimize the cost of not getting vaccinated. When an unvaccinated person gets sick enough with COVID-19 to require hospital care, which is 13 times more likely compared with someone who is vaccinated, it is very ugly. COVID-19 kills people, and if it doesn't kill them, it levels them for weeks, sometimes months at a time. It tears families apart. It causes irreparable moral injury to those who care for them, and it is costly. It is so many horrible things, and at this point, it's almost all avoidable. We have highly effective, safe vaccines that prevent the overwhelming majority of COVID-19 infections, from the mildest to the most severe and life-threatening. Decision makers have the necessary evidence-based policy tools, measures that reduce community transmission, relieve pressure on the healthcare system, and increase vaccine uptake. Vaccine mandates are effective, and they are justified. Expanding proof of vaccination to all facilities and all events in the city will help bring this crisis under control, help our healthcare system recuperate, save lives and livelihoods, and ultimately move us more quickly into a period of recovery. I strongly support this motion, and I would also encourage City Council to consider the following, which is to remove the negative test loophole. Exemptions for those eligible for vaccination should be by medical exemption only. And I would also urge the city to institute indoor gathering limits in all facilities and for all city events. Thank you very much for your consideration.
Thank you, Mr. Conway. Councillor Bresciani, do you have a question for the delegate?
Thank you, Madam Mayor. Yes, I do. Thank you, Dr. Conway, for coming forward and all of the work that you do, as well as the staff at all of the hospitals. I would ask that you indicated, and I don't think you touched on it, but the children who were unable to get vaccinated. Can you just give us a little bit of share your information with, and we've read it in the media as well, that we've had 3 deaths, which is the highest in all of Canada. But can you just elaborate how it's affecting our young people who are unable to get vaccinated? Through you, Madam Mayor.
Yeah, so I don't have a lot of first-hand experience with the pediatric side of things. Like you, I know that there are 17 patients, or as of last week, that were admitted with COVID-19, so we're sick enough to require admission. I think, I hear and I see a lot of families very worried about their children, about sending them to school, trying to balance the risk of sending a child to school where they may get COVID from a classmate or a friend, with the harms of sort of keeping them out of school. I also hear a lot of frustration with parents about the public health measures not really making sense, and the protocol that they follow, which sort of flies in the face of what the evidence is. So that's been my experience with it. On a personal level, we've had COVID scares at the daycare where my children attend.
Kimberly, line 2. Kimberly, line 2.
Sorry, that overhead page is getting in the way. I think the toll is pretty huge, and I think if we had greater vaccine uptake among those who were eligible, so those over 12, and particularly adults that encircle those children, I think that a lot of those worries and a lot of that fraught balancing act that folks are undertaking would be lessened, and wouldn't go away completely, but I think it would be much easier for parents to have their children go to school and attend events and sort of get back to normal. Unfortunately, we have uncontrolled community spread, and a lot of that is happening in folks who are not eligible for the vaccine. But if we surround them with everyone who can be vaccinated, I think we mitigate that. Okay.
Thank you. Just the last question to you, Madam Mayor, is just regards, you touched on it, was the medical exemptions. There's not everyone that actually can get the COVID shot. What is that medical exemption? Are you aware of that?
Are you asking me, or?
Yes, I am asking you.
Okay, sorry. The only contraindication to getting a COVID-19 mRNA vaccine is an anaphylactic allergy to any of its components.
To the chair, sorry if you can elaborate, does that mean that you actually have to get the shot first, and then that would determine whether you're anaphylactic? Is that clear? Am I clear through the chair?
So if you've had an anaphylactic reaction to a previous vaccine, or if you have a known allergy to the vaccine components, you would be eligible for a medical exemption.
Okay, so just, sorry, and I'm not a physician, so I just want to be clear. So what does that mean in the layman terms? Does that mean that you would have to be either had a reaction of some type of to some other type of a vaccine? Is that what you're saying?
Yeah, so I'm not a COVID vaccine content I'm not an expert on that. I don't know every single ingredient in the vaccine. But if you've had a documented allergy to a previous vaccine and there's a component from that vaccine in the COVID vaccine, that would be a reasonable exemption.
Okay, I'll leave it there. Thank you. That's all I have.
Thanks, Councillor Bresciani. Councillor Stadnicek.
Through the mayor, thanks for presenting today, Dr. Conway. I did want to follow up a little more on your comment that you would like to see a removal of the negative test for indoor facilities. Can you give us a couple of reasons why you think this would be a good idea?
Sure. So, I think fundamentally the negative test loophole is, I'll call it that. I guess they don't call it that, but I've been calling it that. I feel like it's a loophole. So it's a way for folks who aren't vaccinated and don't plan to get vaccinated to get around the proof of vaccination requirement. It's certainly, I don't think, as safe as having a broad-based, all-applying vaccine proof of vaccination status. The tests, as I understand it, need to be 70 to 72 hours old, which to me is not particularly reassuring. We have stopped asymptomatic testing, or are trying to stop asymptomatic testing in the SHA. So folks who are asymptomatic, I'm not sure where they're getting their negative tests. They're probably paying out of pocket for them, which is sort of an issue about fairness and access to that to the testing that's required. Those would be the ones off the top of my head.
Okay. Through the mayor, do you also believe that if we eliminated that negative test requirement, that if to enter a facility you need to just show your proof of being double vaccinated, would that encourage more people to get vaccinated?
Yeah, I think it would. I think we saw quite a significant uptick in vaccine uptake when the province-wide proof of vaccination was announced and implemented. And I think every time we make it more convenient or make it more inconvenient for people who are choosing not to get vaccinated, I think that's going to cause a reprioritization for folks, and hopefully pushes more people to getting what is a safe and effective vaccine.
Okay, thank you. Through the chair, just another question. The Saskatchewan Ministry of Health, I think it was the Ministry of Health or the Saskatchewan Health Authority, had done some modeling that shows that if there aren't gathering restrictions or more public health measures, that our numbers could get quite bad in this province. Even though our numbers are somewhat low in Regina compared to other places in the province, does the modeling also give us a warning that we need to be taking additional measures in Regina just to keep things under control?
I can't give you an expert's answer on this, but okay. I would say yes. I think, I saw the modeling from last week's Physician Town Hall, and it is quite scary. We're already sort of at our unsustainable level. And so the idea that a lukewarm sort of vaccine uptake is going to be enough to head off the worst scenario in a fourth wave, I think it's dangerous. And yes, I do think we need other measures. We need indoor gathering limits, and we need the mask mandate to continue, or we're headed for even worse outcomes than we're already seeing. And I think, I'm not sure to break down the data city by city. I'm not, I don't have that in front of me. So So I can't give you a firm answer on that, but I think it's good policy, and I think it's, part of, I think, what moved the provincial government to go with a proof of vaccination with all these other public health measures was other groups, cities, city governments, our professional football club, doing it first. And so I think, whether you want to see it in that way or not, I think it helps. Whether we need it or not for our particular numbers, I think we do, but I think it also sort of sends a message that, we all need to do this. So these are the steps that we need to take to avoid basically catastrophic outcomes.
Yeah. Well, thank you very much for taking time out of your busy day.
Oh, you're welcome.
Thank you, Councillor Stadnicek. Dr. Conway, I just have a question for you. What area of medicine do you practice in?
I'm a family doctor, and I also do hospitalist care. So when I'm at the hospital, I care for admitted patients on a sort of a regular COVID-19 medical ward.
Perfect. Thanks very much. I'll thank you again for your presentation this morning and ask that you please leave the meeting. I'll call upon Delegation Aaron Schmuland. Please introduce yourself for the record, the organization you're representing, if any, and where you're calling from. You'll have 5 minutes to address City Council, after which time you'll have the opportunity to respond to questions from Council. Good morning.
Good morning, and thank you for the opportunity to address Council this morning. I'm calling from my home in Ward 4, and I'd like to commend the administration for bringing this report forward to Council and note that I'm in full support of the recommendation to implement proof of vaccination at all City of Regina facilities, including our arenas. Aligning to this recommendation today, I believe has the potential to make a significant impact in our community's ability to come through this fourth wave in which Saskatchewan continues to see a surge of COVID-19 cases. Like for many of you, I'm sure this topic is very personal to me. My husband and I have 3 young boys who are not yet eligible to be vaccinated. Our boys are very active and absolutely love to participate in sports, with hockey being their first passion. And just to give you some context, I would say that to say that we're a hockey family is likely an understatement. Our boys play in the highest level of competition for their age division, and my husband has played the role of head coach and or assistant coach every season. When the boys aren't at the city arenas during the winter, they spend all of their free time skating in our backyard rink. This weekend alone, we spent approximately 10 hours at arenas for hockey practices across their 3 teams. As this hockey season was approaching, I had conversations with many families across the city whose kids are involved in minor sports. And we took a lot of comfort knowing that the City of Regina was implementing a proof of vaccination program at its facilities, and we were all applauding you for providing such inspirational leadership to our community. And that's why many of us were so disappointed to hear from Hockey Regina at the beginning of this month that you were decreasing your measures at some of your facilities, including arenas, to align to the provincial health order. We know that this fourth wave has significantly impacted children who have not yet had the chance to gain immunity through vaccination. Kids under 12 now represent a third of new coronavirus cases in Saskatchewan. And Dr. Shahab has publicly stated that the most effective way to protect our unvaccinated children is to ensure that those who are eligible for vaccination get vaccinated. He said, when you surround your children with vaccinated people, transmission will not happen. By exempting arenas from the city's proof of vaccination program, we cannot rely on a reduced risk of transmission knowing that we're surrounded by vaccinated citizens. As parents, we've entered into this hockey season faced with the harsh reality that we're exposing our unvaccinated children to unmasked athletes from non-vaccinated homes. So today, I'm asking you to align with the administrator's recommendation and introduce additional measures to protect our children. Proof of vaccination is required for tennis players, speed swimmers, or swimming lesson students, as an example, using city facilities. So I struggle to understand why the council has lower standards and expectations of those families using arenas. All children in our community deserve the same level of protection that you've courageously offered to others. The majority of Saskatchewan residents have done their part to protect themselves and one another. Other communities, such as Saskatoon and Prince Albert, have implemented facility-wide proof of vaccination programs. Please follow their lead and reinstate the proof of vaccination at all city facilities. Let's do what we can now to ensure our youth have a safe season of competition ahead of them. If not, they'll routinely be in isolation due to close contact, or worse yet, infected with the virus. Thank you for your time.
Thank you, Ms. Schmuland. Do any members of council have any questions for the delegate? Seeing none, I'll thank you very much for your presentation this morning, for appearing before us, and ask that you please leave the meeting.
Sure, thank you very much.
We'll now consider item CM 21-20, the COVID-19 update. As council is aware, I had a call with the Deputy Chief Medical Health Officer for the City of Regina on Friday and called this special meeting as a result of that. I can report to you that our cases continue to be in a steady decline, slow but steady decline. The issues with COVID, as we're all aware, is that it does take a long time to go through our hospital system. And so this decrease in cases will take a few more weeks to be reflected within our ICU numbers. Currently, our ICU numbers are a reflection of the late September caseload. I'm pleased to report that in the City of Regina, the first dose is sitting at about 85%. I'm more pleased to report that 90% of our 12 to 17-year-olds have received a first dose, and that is a good indication that that will continue through and our children will be protected. The eligible population in the Regina area, which doesn't just include within the boundaries, it includes those neighbors around us from Grand Coulee to Pilot Butte to White City, are included in the Greater Regina area. And why that's important is they're also included in our Hockey Regina numbers. We have 232,000 people who are eligible for vaccination. The recommendation from administration today that council is to consider is because although we have a slightly higher than provincial average vaccination rate, we have 49,000 people who are eligible for vaccinations in the Regina area who are not yet vaccinated or fully covered with 2 doses. The idea is that we need to create a safe environment in order to continue to participate in activities which we know are good for our physical and mental health. The idea is to reduce undue risk, to stop pushing the virus around. With that, I will turn it over. Can I have someone from administration please introduce the report?
Good morning, Mayor Masters and City Council. Given the situation affecting our healthcare system and the continued high risk of COVID-19 transmission being uncontrolled throughout Saskatchewan, we're recommending in front of you the expansion of the proof of vaccination or negative test requirements for all city facilities, except for the Regina Public Library and Transit Information Center, effective November 1st, 2021. We have had conversations with Rial, and Rial will be following a City Council direction as it relates to their facilities coming out of this conversation today. We also have heard continued concern for the population that may be at most at risk. So if you look at Appendix A, you will see what the requirements for proof of full vaccination would look like, as well as the requirements for negative testing. You will see at the bottom that individuals entering premises solely to use a washroom or for the purposes of health and safety, which may include vaccination clinics, heating and cooling stations, food security programs, or other services that address basic needs, would continue to be able to access services. So we're trying to find a balance for our vulnerable population as well as those of us within our community. And with that, myself and members of the administration are here to answer questions you may have.
Thank you. Any questions for administration from council? Councillor Stadnicek, I'm going to ask you to move the report.
Okay, I will do that. Thank you, Mayor Masters, and through you, a couple of questions to administration. When you were reviewing this report, did you also consider in any way, as was suggested by Dr. Conway, that we would remove a negative test requirement as an option? I just want to know if that was considered and what your thoughts on that are.
Through you, Mayor Masters, we did consider that. Now, again, testing is very specific, and the requirements for negative testing are very specific based on the requirements we've outlined. You do need to provide that negative test within 72 hours, and we know that right now it's very challenging to get test results within that 72-hour window. So the current conditioning when it comes to private testing is actually driving towards vaccination at this point, and we felt that allowing that testing piece, even though we understand there are very few medical reasons why people may be exempt from vaccination, for those few people who are, testing does still provide that option.
Okay, thank you. Through you, Mayor Masters, do we have any information on those who are coming to our city facilities? How many of them are showing proof of vaccination, and how many are actually opting to show a proof of negative test? Any sense at all of that?
Thank you for that question. I might ask Ms. Sellinger to provide an overview of that. Of course, her team is responsible for our major leisure centers.
Through you, Mayor Masters, we are having very few people who are showing a negative COVID test. For the most part, people are coming prepared with their proof of vaccination.
Okay,
it would be a very, very small percentage.
Through you, Mayor Masters. Another question too. I know that we have some major events that are going to be coming to Regina, like Agribition in, 3 or 4 weeks. What will be so because that is on Evraz, on the real campus, what will the restrictions be for Agribition?
Through you, Mayor Masters. So I know the Canadian Western Agribition has outlined very clear requirements in terms of proof of vaccination being in place to enter the show. In addition, on the Riel campus, they're looking at how they would be able to activate proof of vaccination and negative test requirements. And I'm anticipating they're just discussing now whether about anybody entering the gate in terms of that access, property access would need to provide proof of vaccination. As well as or a negative test. And of course, masks are currently required. And I will take us back to September when, of course, as a city, we did move forward on indoor masking requirements sooner than the province did. And I think that has served us well.
Okay, thank you. I don't think I have any other questions. That's it, thanks.
Thank you, Councillor Stadnicek. Councillor Zakidniak.
Thank you. I just have a question in relation to some comments that I've been receiving from residents. So can you, through the chair, please explain the rationale between using commissionaires instead of city employees to check the vaccination passports?
Through you, Mayor Masters, we have done security risk in terms of all of our facilities. Of course, when we initiated this, we wanted to ensure that we had the proper resourcing to be able to deal with any escalated situations. So we have been using third-party security services currently to check proof of vaccination or a negative COVID test result to this point in time. That enables our city staff to continue to focus on the service they need to provide inside the building.
Thanks. That's all I have.
Thank you, Councillor Zakidniak. Councillor Stevens.
Great, thank you. Support the recommendations. For administration, to follow up on the last point, are there any incidents that need to be brought to our attention? Are commissioners being confronted? Is it typically residents are complying? Any comments about that?
Through you, Mayor Masters, it's my understanding that overall, generally, and again, this is a generalization, most of those entering our city facilities have been very respectful to date, and I might ask Ms. Selinger if she has any additional comments to add to that.
Through the chair, as Ms. Folk stated, most people are respectful. We have had some incidences that have been documented, and there has been an incident or two where we've had to reach out to the RPS, but for the most part, people are complying. Specifically at the major recreation centers, there's been no issues at the neighborhood centers where we're checking for fitness only.
Thank you. Through the chair, seems like the requirement brings some comfort to residents when they're accessing city facilities. Can you comment on whether or not the initial rollout of the vaccine mandate affected attendance? Did we see it stabilize? Did it go up? Did it go down?
I might ask Ms. Selinger to comment on that.
We have seen a slight decline. We saw some people who withdrew from their programs. We are starting a new registration session, so we will continue to see how that impacts it long term.
Thank you. Just to confirm through the chair, I don't want to see any loopholes here. When it comes to accessing the Evraz campus facilities, that applies to ticketed and non-ticketed events, correct?
That would be correct.
Okay. My next question for possibly the mayor and administration. In your dialogue with the Saskatchewan Health Authority, what other recommendations are they asking for that might fall outside of the purview of the city's jurisdiction? We've heard calls for indoor gathering limits. Are they raising that with you, and should that be something that we push for at the provincial level?
Ms. Spoke, if you go first, I'll respond second.
Sure. Thank you for the question, and through you, Mayor Masters, I might point council to page 2 in terms of the communication section in the report that was in front of you. I had the opportunity to sit in with Mayor Masters on Friday with Dr. Hennick, and I think this really is continuing to encourage vaccination as that best defense for positive health outcomes, as well as ensuring you're getting your flu shot in addition to in addition to your COVID vaccination. And continue to take care with family and friends by limiting your household bubbles. I think the Saskatchewan Health Authority is continuing to see transmission occurring in households where there are unvaccinated people. And it really is, from a public perspective, demonstrating leadership that we're creating safe places within our community by requiring proof of vaccination and a negative test for those 12 and older. And with that, Mayor Masters.
Thank you. Thanks for the question, Councillor Stevens. I've heard from both the SHA modeler as well as, again, at length with Dr. Hennick, which you'll have another update again this Friday with him, Council. I will tell you that with regard to being out and about in public, and he referenced movies and restaurants and other venues are doing a really good job. He's really impressed with how retail and restaurants have responded. He's equally impressed with all of the corporations who are putting in proof of vaccination. He said that's how you're going to carve off a large chunk. And in fact, when I discussed the idea behind the motion recommendation before you today, he said that he suspects the majority of individuals that are entering into our facilities are already double vaccinated. He did bring up, Dr. Hennig did bring up that if he had a caution for people, it's that to be aware of the vaccination status of individuals that you invite into your household. And so it's about household mixing and still keeping those small. Going out and meeting in public, there's really good measures in place from proof of vaccination to masking to sanitization and a bit of social distancing. The caution was about residential indoor gatherings. Sure. And in fact, he brought up that if you were to compare across jurisdictions, I believe one of the provinces has no more than 25 people in your household. And he said, you know, you can put in something that's token at best, but really it's about residents being cautious with both vaccination status of guests or homes they're attending and keeping their household gatherings small.
Okay. I guess final follow-up to that, were there any recommendations to limit gatherings in city facilities, whether it's a Rider game, a Pats game, anything to that effect?
He had a comment about the Rider games in terms of actually how good it's been. There have been very, very few cases of transmissions at Rough Rider games. He said that could be in part due to being outdoors. There have been only a few Pats games, but nothing of significance coming out of those. He said that when you're attending events like a Pats game, you're walking around in a mask, you're sitting at your desk, but you're really not sitting in close, personal contact like you might in your living room or standing around a kitchen party, perhaps. So he had comments about that. He did also say that it's important at this stage. He said the case numbers in Regina are steadily declining, and we are doing better than the rest of the province in lots of ways as it relates to cities. That we may have increased immunity from what we experienced back in March, April, and May, and that we do have higher vaccination rates. He suggested that it's important that we continue that transitioning to living with COVID because it's not going away. He did say the tail end of the pressure on the ICUs right now, which peaked at the end of September, should start to be realized over the next few weeks as well. So he had some cautious optimism about how things were going, but that we all need to be vigilant, and that the recommendation before you was good to create safe spaces for people who are double vaxxed to be able to participate in those types of events.
Great, thank you. Appreciate the cautious approach. If new recommendations come from the SHA, I hope that comes before Council for consideration. I'd certainly support it. Thank you.
Thank you, Councillor Stevens. Councillor Bresciani.
Thank you, Mayor Masters. Thank you to administration for this report. I think that we know that we've heard from many residents in this regard that they were so proud that we had moved forward in this, and were very, I think, upset when we moved back following the guidelines that came out with the province. But I would like to ask administration, when we did go back, did we hear an outcry from the public at all as to why we retracted, or I guess what was the feedback there through the chair?
Ms. Polk?
Through you, Mayor Masters, we've heard many things from the public on this item on both sides of the continuum. So yes, we did hear from some, and we also heard from some that they were not wanting us to move forward with proof of vaccination. And I would say that response was relatively balanced and more outweighed on those who were not looking for proof of vaccination.
The unvaccinated, okay. Just a question in regards to medical exemptions, which we know that there are a few people out there, some be youth, that cannot actually get the shot. What is the process with the medical exemption moving forward to access our facilities in this way? So it would be a proof or a test, but I guess one of the questions was if they are deemed to have a medical exemption, is there something with the cost at all that is deemed in that regard through the SHA, through the chair?
Through you, Mayor Masters. In terms of the cost of coverage for a negative test, if there is an exemption, we'd have to follow up directly for what the SHA has in place today. It's my understanding that they are requiring even those with exemptions to bear that cost on their own.
Okay, thank you. Sorry, so did I hear that because if it is a medical exemption that our staff would be asking the SHA how they handle that, or if there's some kind of a, because if it's medically deemed, that there is some kind of a cost to that, decreased cost?
Through you, Mayor Masters, at this point, we have not provided any cost or any cost of testing for anyone, regardless of whether or not there's a medical exemption or not. So I think, okay. Councillor Bresciani, if your question is, do we know if there's subsidization of testing for those who have a medical exemption? At this point, our understanding is there is not. either through the SHA or through our current practices and policies.
Okay, thank you. To the ask, I guess the last point is that we know that our children that cannot get vaccinated yet are most vulnerable. I myself have been in the arenas where we see families come in and out with an hour time frame, and there's many people that actually come into those arenas during a shift change, so it's an hour in and an hour out. And I believe this is vitally important to our community, our city, that we move forward. I'm so grateful for this report. I'm grateful for our administration. There's one important factor, and that's to protect our children, the ones that cannot get the vaccination, but also to the people who and the grandparents who have taken and parents who have taken the COVID shot that want to continue to come and enjoy life as much as we can during a pandemic. When I read the stats, Saskatchewan has hit the record for the number of kids in hospital with COVID-19. That sent a real message. And that, we have had, I think, more children hospitalized with COVID-19 recently than any other during the pandemic. So again, I think that, and we heard the stat that there are, three children that were under 12 that have passed away. So I just want to say thank you for this report, and I am grateful that we are moving forward in this regard. Thank you.
Thanks, Councillor Bresciani. I do need a seconder for the motion. Thank you, Councillor Hawkins. Seeing no further questions from Council, I have a question of administration. Ms. Vogt, could you comment a little bit on the recent position that the Human Rights Commission has taken relative to exemptions?
Thank you for the question, Mayor Masters. I'll start, and then I might ask Mr. Weary to provide additional comment. So the Saskatchewan Human Rights Commission has clearly indicated that there are very few, if any, reasons for exemptions from vaccines, and any consideration that they may take would be in that regard, and I'll ask Mr. Weary to provide additional comment.
Thank you, Mayor Masters. Yes, we're monitoring statements from human rights commissions across the country as this issue continues to evolve in the community. I'm not sure there's much more to add to what Ms. Vogt has said, but certainly the approach that is being recommended in this report, in our view, is a defensible approach, but we will evaluate any changes to that, and we'll advise Council as any new information or advanced rulings from the Human Rights Commission come forward.
Thank you very much, Mr. Weary. I believe no further questions from Council. I'll close off with saying my appreciation for the SHA and the outreach of Dr. Hennick is enormous. In terms of the updates that he is providing to us and keeping us on top of some of these numbers coming out of Regina. I am encouraged with the rate of vaccination. One would assume that if we have 85% of our residents in the Greater Regina area who have received their first dose, that means they will sign up for their second dose. Again, but having said that, as first dose, we still have 49,000 people who are not fully vaccinated, and I think the number that we're attempting to address a little bit here today is that those who are not eligible, 0 to 12 years of age, in the Greater Regina area number 41,000 kids. And so anything we can do to continue to ensure they have safe space to play should be supported by Council. We would look for that. Thank you. Mr. Kirk, you can please call the vote.
Mayor Masters, there are two members of council absent from today's meeting, that being Councillors LeBlanc and Councillor Moule. All other councillors are in favor of the motion. It passes 9-0.
Thank you very much. Thank you very much, Council. Can I have a motion to adjourn the meeting? Thank you, Councillor Fundura. Any opposed? I need a seconder. Councillor Stevens, thank you. Any opposed? Adjourned.
Rather than going